Hi, Ray. I'm Adrián. I'm the Chief Technology Officer for Virtual Care of Providence. For those who don't know, Providence is a health system in the Pacific Northwest, about 29 million visits per year, 52 hospitals, 1,000 clinics, and from those around 1.5 million people doctors, which is people making this in the world. Regarding background, computer scientist, about 20 years in the industry, all over the place, consumer electronics, space technology, a few startups, and this is the company.
Hi, Mackinnon. I'm a partner at the Stratafusion Group currently, and also a senior advisor to HiPaaS. I guess I'll do it in reverse order, but Stratafusion, my name is about that, which is creating the execution from strategy into implementation and changing directions for organizations and capabilities. So it can be anything from security to modernization of systems, which I spend a lot of time on, to acquisitions, and that sort of thing. So this continues to change. And mostly I spent my career in financial services, in healthcare and insurance. And as a CIO in healthcare, I was a CIO at the Shield a number of years ago, and worked with a number of people here in the room. So I'm excited for this today. I love what Sandeep has done, and I love the direction he's taking. And I think the conversation today so far has been terrific for me. So thank you, Sandeep, for organizing this fantastic.
Absolutely, thank you. Hey folks, I'm Jeremy, your moderator. So starting with the first question, it's a similar use cases question, but specifically focused on health plans, patients, and employees. What are the top use cases that you see today with AI being applied in the health plan space for patients, employees, or improving experience?
Well, I would say that the biggest one we're seeing is definitely patient navigation. How to get the patients to navigate the system to really the right type of care. How to do it in a way that is no wasteful, that is pretty fast, pretty profound again. Today, we analyze the patient life cycle, and it takes a lot of iterations but we get to the right moment. Moreover, when you actually get care, but you follow up and get to the right lab or the right provider, even something as simple as getting the best possible doctor for the condition is a really big challenge. So I really think there is significant opportunities in this space, mainly because the data is there. Somehow it's not being utilized in the way I think and you think should be done. Because still, how many times you as a patient go to the doctor and it's like, hey, you're not supposed to be here. It's the wrong place, so it's the wrong appointment, it's the wrong specialist, right? Some of the numbers we count is that around 50 to 60% of the referrals are unnecessary, right? So from a health plan standpoint of view, from a patient standpoint of view, there's so much waste. So there's a big opportunity for systems to really figure out like, who you are, what are your conditions, what other patients have done in a similar condition, and how successful they were doing that. That's, I would say, opportunity number one. Opportunity number two, I think all of us know, is the back office documentation piece. We still have armies of coders, we have still armies of folks working on prioritization, making sure that we get the right claims. All of that is kind of ready for the disruption.
You know, I think it's an interesting question about use cases. I think Sandeep and I talked about this for about a year, right, Sandeep? And there's sort of two pieces to it. One is what we see, I'll call it aspirationally, understanding the capability of AI and all the wonderful things it can do, and then the gap between that and the reality of the payers. Now that's kind of more my world is in the payer world, somewhat in the provider world, but really more in the payer world. And there's such a big gap there. And so I think when I look at what health plans are doing, what they're talking about, and the directions they're heading in, they're sort of putting a toe in the water. And there's a lot of focus on process and using AI to change fundamental processes that are used on a daily basis, more than a daily basis. And it sounds so, in a way it sounds mundane, but it's the fundamentals. And I think to your point is leaning into the patient experience, the member experience is important. I would say though that plans from a technology point of view, I think lean into their own processes more than they lean into the customer experience. And so I think that use case for the customer experience is what we're hearing people talk about, and I totally get it. I'm there, I'm 100% there. That said, I think you have to start somewhere, and things like authorization, enrollment. I mean, some of these things are so fundamental, but they're so problematic still for so many plans, and so much of it is manual. So I think the opportunities, people, they struggle, plans struggle with the place to start because of the risk involved. And so I think there's a lot of opportunity there at lower risk, and where the appetite will be it fits better in how they think about things.
Absolutely, and I think we've been seeing exactly what you've been saying, Elinor, with the health plans that we've been working with at HiPaaS, claims, enrollment, right, data management, the membership, the member experience. I had the next question is also for Elinor here. Elinor, as in your career as a CIO, including Blue Shield and many other payers, what is the problem that you would like to see solved by AI? As a CIO, like, oh, yeah, it would have been great if I had this as a CIO. What's the problem that you want to see solved?
Well, I would like to see the member experience solved. And I would like to see a journey for a member that, was flexible and somewhat personalized and fit to how they do things. I also make a comment about the use of technology. We know in the insurance business broadly that the most common touch points with our customers are negative touch points. One is when you pay your premium, right, when you sign up, and the second is when you have a problem, you call them. So in the industry, it's a very tough thing, and both of those things are very emotional touch points for people. And so I think there's still that big gap, and so for me, aspirationally, I would love to see a really deep understanding and commitment to the patient as a person, and a process that works for them versus working better for the plan. It should work for everyone, but I would love to see that.
From my side, I will say shortage is basically the ability to provide good care and the right care to the patients. It will include data. Within the next 5 years, we will be missing out 100,000 doctors, right? All those important, 40,000 of those in primary care. I won't say systems collapsing, but there's not enough people to provide care. If you look into the fundamental reason why you go to a doctor as a patient, from a computational standpoint of view, you go to be confused as a patient, right? You can put your conditions, your data, and the doctor has the medical knowledge. The problem is that the patient chart has been growing tremendously, right? If you look right now, the average patient chart, like session level, around 45% of the patient chart is testimony in terms of studies, right? So it's humanly impossible for a doctor to actually compute you. And that's the opportunity, the big opportunity for AI is how do you provide systems, in which the full spectrum of caregivers, right, from NAs to RNs to physicians, can really practice to the top of the license, right? How do you eliminate waste because you are doing the next action, because you need what you need to do with your patient, right? All that is one problem that if we don't fix, we don't have tremendous issues providing care to those that really need it. And I think the opportunity for AI is that not only for the models, but from the clinical workflow standpoint of view, right? When you look today into the amount of clicks a provider or clinician actually does to take care of you, and then scientists, right? When you look into the amount of the targeting you need to do to find out what's your condition, it's another scientific piece. Moreover, if you can actually get there out of your healthcare system, as opposed to travel to Southern California and then you could pay in Texas, like do that with that, and getting the records of treatment value. So all that is the big opportunity that we have. And frankly, I actually don't believe it's a question of do we do it or not. It's like if we don't do it, we're going to have tremendous issues.
Absolutely. This next question is for you, Adrián. It's a two-part question here. Half the folks in this room are building AI technology companies. And I think, similar to my personal experience, one of the challenges that we are solving as AI companies is navigating adoption. And we'd love to, the first part of the question is, what is your best practices, guide, process for AI adoption and accepting, approving new technology. And the second part is, can you tell us about MedPearl and that story?
So, current adoption and how we do things at Providence, or how we've been doing things for a long time is, from a global understand point of view, you need to develop for your product for your users, right? And that's a really basic statement, but the reality is that if you don't involve the final users as part of your code development process, most likely you're going to end building some users stuff, right? All of us, I think, have working products that they were a great idea, but it was not a problem to solve. So, involving those that are going to be users, really understanding the workflow. I mean, clinical care today happens in the EHR, whether you like it or not. That's the place where physicians tend to live. So you need to have EHR integration. You need to make sure that there is smooth, that they actually can access your tools and your products into a way that is not an extra step. The biggest feedback I get from clinicians every single day is that I cannot do more. I don't have time. I am spending my nights doing these things, right? So integration is critical. And then the other one, I think, is continuous, is like everybody's having a little tough time. I help better in the unit economics. So what is the ROI? Can you really provide the metrics that can justify the investment in the solution, right? Like, I don't go into the companies every single month. People are basically not going to say, you're going to solve your problem. And the fundamental question is like, okay, you will solve the problem I have, but what is the ROI for me? What am I getting in this chance? Is it a health assistant, getting more benefits and seeing more patients? And it's kind of astonishing how many times companies don't focus on that. You need to really figure out how the ROI is there to really justify the buyout. Because, just to conclude, the sales cycle of healthcare takes a long time, right?
I do have a follow-up question about MedPearl and that story.
The story of MedPearl, for those who don't know, is an incubation that happened in Providence. We started working on that 3 years ago, and the idea was, based on the premise I discussed before, like, doctors don't have enough computation. So can we create a secondary, can we create a place in which you contextualize the data patient and figure out what are the best actions? So we get a technical product. So when we envisioned the platform was like, can we create a GitHub as last week PDF for doctors, highly supervised with all the governance, and can we actually connect it to the EHR? So what MedPearl does today is basically providing doctors what are the best possible best actions based on the patient data. In the past, we have things like up-to-date. Up-to-date, unfortunately, takes a long time to read, right? So what MedPearl does is like, hey, this is your patient, this is the condition they have, these are the recommendations. As a doctor, this is the way we recommend you to proceed. The way we actually scale that in Providence and other of the systems, with more than 7,000 users these days, was really making sure that the ROI was there. If you use MedPearl, you can see more patients. You're spending less time charging, you're providing better care. Moreover, we have now countless stories of patients that, thanks to the tool, we actually save them because doctor was missing something. They didn't have the right information. I mean, it's not a secret that doctors Google stuff all the time because it's impossible. It's not impossible to know. So the game there, the game changer for us in adoption was, let's make sure that we are adding value. We're using performance, including the top of your license, and fundamentally making sure that providers can trust the solution. Because one of the biggest challenges we have with AI today, at least if you use our market, is that people, especially clinicians, they're not suspicious about it, right? It's kind of interesting. Like, doctors are not, they didn't tend to be right all the time. In fact, there's a big curve and this is failure on that. But they're way to start them with AI. The benchmark in this position is really high. So the goal there has been like, it's an assisted technology, you continue being in charge, and by the way, this is the benefits for you with ROI. So we focus a lot on the ROI metrics.
Thank you for that story and that example as a model that we can follow. Folks, do we have any questions for the panelists? I have one more question I want to ask, and I'll open up to the audience Q&A. So I did want to sort of bring back and just humanize this a little bit and learn about folks personally. A trend that I learned talking to people in healthcare on our podcast, on HiPaaS, is people get into healthcare for very interesting reasons, I found. It's very different from other tech or other experiences that I've had personally. So I'd love to ask both of you, why did you get into healthcare?
I can tell you exactly why I did today. I was worked at Charles Schwab for a long time, and I was sort of thinking about what I wanted to do next. And it struck me that what was going on in healthcare was not that different than what had been going on in financial markets over the years I've been there. And I'm always that person like scratches my head and go, like, why can't they solve that problem? You know, through that curiosity thing, you want to go and like see like what's wrong, like that's fixable. And so that's what I wanted to do. And I didn't really know what it was going to be like getting in there, but I was very deliberate about it, and I ended up with Blue Shield. I was very persistent, actually, about talking to people there and using my contacts to join. And you know, I'll tell you, I've kind of gone. I went from there back out into insurance and some other things like insurance and CIO, et cetera. It always calls me back. You know, I can't even quite describe why that is, but that's what happens. I'll sort of, and it's wonderful to go and explore other things because it brings you different points of view, but it just calls me back, and when I'm back, it sort of feels like where I'm meant to be.
Well, mine's more like a question on what's happened in my life, so I have already lived life since forever. I was working with that, and as a European, I was raised with the idea that healthcare is great and everything's fantastic, and you know, I never go back to that. So, and I didn't have kids, so for quite a while I couldn't care myself healthcare, but eventually I got kids. By chance, I met someone, Adrián, which is the chief executive officer for Providence, and she showed me that in a pretty, I was a random meeting, that the way clinical guidance was being communicated to doctors was based on PDFs and decision trees. That's basically how we were being taught what to do with the patients. And I didn't have, after that, the ethical courage to look to the other side. I felt like I need to work in problem like this. I cannot believe that the way healthcare today is medical knowledge receive some PDFs and the doctors will look to that, and then everything is kind of so broken. So that was it was confidence. I wasn't planning to. And since then, obviously, being more involved in all the different activities we have at Providence and doing that. And I really think it's one of the most meaningful things we can do as human beings is to work on something that affects all of us. So it was completely valid.
Can I add a funny little factoid? I happened to hear, actually, by the way, like you, I came from another country. I'm Canadian, and I was just telling somebody this anecdote. The first time I went to the doctor, they asked me whether I was a PPO or HMO, and I looked at them and was talking about that. Is that like the doctor I'm looking for?
That's right.
Right? It's such an odd experience.
That's right.
But anyway, so I happened to be listening to something last week, and if any of you have to follow the NHS in the UK, they had their own sets of issues, obviously. So that is a lovely fact. So the number one procurer of fax machines in the world is the UK, the National Health Service. And who do you think the second and third countries might be as procurers of fax machines?
Make sure there's a fax machine in Germany.
Yeah, I'm telling you, it's healthcare, right, in the US and a couple of other countries, but it's sort of, you see this big gap. This is what's so astounding, right? When we talk about the future and what we can do with AI, and then you walk in and there's fax machines everywhere, and in the provider's offices, honestly, as well, right? So anyway, it's just sort of something you want to sort of see the gap that's out there and the potential. There's lots.
Absolutely. I want to thank our panelists for speaking with us. I want to have a I'll ask you this. Have you ever wished that you could sit in the office of a CTO or CIO at a major health plan, of your company? Now's your chance to ask those questions and learn about how things work. Questions?
My question, you talk about patient navigation as one of the top use cases. One of our current clients, hospital, their issue is on patient navigation on their side, and he and I talked just a little bit about. Well, the hospital has what they believe should be the right patient navigation, and then subacute has a different idea, post-acute has a different idea. Payers who are actually paying the bill for this whole thing have yet another idea, and that's what they asked us to take a look at. Was, oh my God, this is not really a technology problem, right? This is getting the business to all agree. So when you're talking about patient navigation, have you found anything to be successful that says hospitals or all the variety of sub and post-acute facilities?
I think the biggest is just public knowledge. with API with Microsoft a few months ago. The biggest benefit for patient navigation for us was messaging analysis and messaging deferral. Basically looking what the patients are writing us and trying to figure out we can automate the response, right? Because we get millions of messages all the time, right? And patients are trying to figure out a way. We totally to go, where's my lab test, all that. So the biggest, I would say, benefit for us, and I recommend you Google it, was that when we look into the messaging that they were sending us, and we analyze it, and we figure out if there's anything that we already know that we recommend to the patient, that was around 33% decrease on message deferral. That's the only thing I have seen working so far, beyond throwing balls at the problem, which is obviously just having people calling the phone, and people answering things, and things like that. We're investing heavily now on text-based navigation as well, like basically through chatbots, so text-based recommendations. That's working quite well for us. That we can full control the system. When you have multiple players, multiple health plans, and things like that, I don't think there's yet a solution.
I'm going to kind of come at it from maybe a different angle, but I think it's a good question, and I think it's a very big question, right? So I'm going to try to speak as a CIO sitting there with the opportunity and the pressure to do something with AI, and what am I going to do? How am I going to make a decision on what I should do? And I believe the first thing that needs to be done is what I call positioning, and that is positioning for the company and of the company to have that discussion with the executives about how they want to think about the role of AI. Now, this is never a forever thing. That's not how strategy works. But I think, for anybody here happen to go to Dreamforce or Tim Dreamforce, for example, they're brilliant at this. And I watched them do this. Did you see that? They're absolutely brilliant at it. And I'm like, wow, there's a lot to be learned from that. So I paid attention to what they're doing. And what they did, the whole first part of that, and consistently all the way through, is they positioned what they were using AI for and how to approach it. And so after the first hour, it was very clear in your brain that they were doing AI plus people, AI plus people, AI plus people, right? And they never got off that message, and they're not getting off that message. That's what Agent Force does. And so what that says is that's how they're positioning themselves about how they approach things. And so there's all this other stuff goes on about technology and, oh my God, it's going to replace people, and we hear this with doctors and all those kinds of things. But I think it's actually it's what I call the and. It's looking for the and in there. And I love actually that message, and for me, it just personally resonates. And I think it's a great discussion for a CIO to have with the executive team to understand how they want to think about it, because then you don't have that same sort of fear and resistance out there amongst the people about how you want to deal with your vendors, about what kinds of decisions you want to make, and where you can point your priorities. So that's kind of, to me, is sort of an anchor for how I like to think about it.
Yeah, I have one comment on that one. I think this is going to be critical for folks like yourself and companies trying to sell solutions to really understand what is the process about AI in healthcare systems, right? If I look specifically to us, we have a steering code, and there is like safety lists, ethical points that you need to actually do. There is POCs you need to develop, like really getting into the door and saying, okay, how do folks actually seeing AI? Because we are really opinionated about AI. We have a particular point of view because who we are and in our mission. If you don't understand that, you're not going to get anybody to talk together. And I have seen that with many companies trying to sell great solutions. It's like, I'm sorry, it doesn't fit our workflow. You need to understand how we do things. And also, case studies, going back to that one, and ROI, and how others can be successful with that.
Yes, absolutely, absolutely. I agree with you 100%. And what I would add to that is that the fact that you have a position broadly doesn't mean you have to sort of run out and do another big bang. That's not, don't confuse those two things, right? But it is important, and I really want to say, I really like your comments, because it's sort of, for me, it's about the cost and about the value and the value proposition, which I think health plans are also struggling with. There's no question.
Thank you. And I will say as an example, folks, something I've been seeing now being adopted massively is having technology, right? So you look into the market, you have DAX and Avery, where they're heavily relying on AI models to actually do what they do, which is interpret the conversation and generate notes. The reason why they're being so successful is because the pitch sales is so simple. You're going to not need the scribes. You're able to take notes on the fly. Doctors are going to have less time in the night. if you find the use case that actually resonates with physicians, like we have now doctors like just give me up with technology. Like that's all they care, right? In the past was in the EHR, right? When people would select a healthcare system by the EHR. Now it's this kind of thing like, hey, if you're doing AI, how is it affecting them? Because I mean, they couldn't realize how much it costs. And then from a standpoint of view, is like, what time I get back? How my patients are getting back, right?
The plans care about it.
Yeah, the PIs care.
If I may say so.
The ones paying will care, right? But the physician will care, right? The physician is like, give me the experience. That's what I care. I mean, when you why you're a doctor is because you care about your patients, right? That's what I care, and how the tools are really enhancing that workflow.
Right.
Once again, thank you to our panelists. If you have further questions,
Jump in, Sandy.
Yeah, so one question about, is there a need for an office of AI governance, and what will its role be, especially for the payers or the bigger organizations?
This is a great question. Actually, I'm going to ask somebody else to comment on it here. If I may say so. So I think there's 2 or 3 different versions of governance. I'm going to talk about one, and then, so I'm just going to talk about governance as a structure that drives execution in an organization to deliver to the business strategy. That's what governance is to me. So how decisions are made, what decisions are made, and it keeps people converging all in the same direction. Now, there's a second kind of governance, which is around compliance and regulation. And I'm going to give this back to you, but I saw Honoron and his boss, Michael, is it? Yeah. And on this webinar online, talking about governance, and I think it's just brilliant what you guys did there and how you thought about it. And so I think you should talk about that, sort of the broad view of it. I was very impressed with what they did there.
Completely agree with your point of view. I will say yes, absolutely. We did that for data with the consortium of data, in which we get multiple software systems to figure out how data should be collected. We have tried now with Lotus Health, similar thing, like how we can get together with all software systems to define these kind of things. I think one of the biggest challenges we have is that if you look at this publication from FDA is already pointing out that there is so much complexity in this thing that the compliance part is going to need some help. It's going to require some level of commitment around. And I will say that it's an exciting time to live regarding where AI is today, but we also need to think that it's going to take a few mistakes to actually put us back and get regulators to actually say you cannot do that, right? Because today there's a lot of aggressivity to say how can deploy AI in a healthcare system, and the reality is that if you adopt it widely, you're going to end doing things that you're not want to do with your patients, and that's going to be the whole PR, like we have seen in other spaces, right? In which PR will get, and then but we see this with doctors today. I mean, they criticize ChatGPT and other models because they input something, and it's like, it doesn't sound right. Wait a second, was 95% of the time right? Yeah, but this 5% wasn't right, and they'll be back up as like, AI is not for me kind of thing. So yes, that kind of thing that we somehow not regulated, but we agree what are the frameworks and what's acceptable is heavily needed.